Hello, everyone. In this set of video lectures, we'll be discussing the coding of infectious and parasitic diseases. Let's get started. Okay. One of the things that you'll notice is that the chapter, meaning the chapter of the coding book, organizes infectious diseases by the organism. In other words, the organism that causes it. Keep in mind that the same clinical entity can live in different chapters if it's not infectious in origin. Chapter one focuses on the communicable diseases. We have some really important guidelines that are in the front of the chapter that you need to pay attention to. These are also addressed in your textbook. And these cover such things as HIV, infectious diseases as a cause of disease classified elsewhere, antimicrobial resistance, sepsis, MRSA, coronavirus. And as you move through these and do these exercises, you need to ask yourself, does the site code already name the organism? If not, you're going to use a code, an agent code, if you will, from B95 to B97. And this will make more sense as we look at these specific codes. And again, here are our guidelines again. Really important. A lot of these will make a lot more sense once you actually see the codes. And for instance, you can't have HIV disease and not be asymptomatic. So there's some excludes one notes that you'll notice, particularly on topics like this. And again, here's an example of what we talked about with the agent code. Some of these infectious organisms cause diseases somewhere else. So you would use an additional code from chapter one to identify the organism when no organism is included in part of the infection code. And some examples of this are strep, staph, and enterococcus. They can cause diseases that are classified elsewhere, but you would pick these up as well. So that's why earlier we said, ask yourself if the site code already names the organism. And again, another thing that's going to be different, we kind of touched on it last week, but we need to take a look at infections that are resistant to antibiotics. So this would be codes from code category, category meaning the first three characters of the code, Z16, resistance to antimicrobial drugs following the infection. And again, sepsis gets a little bit more involved. We have coding guidelines for sepsis and severe sepsis, septic shock, sequencing, newborn sepsis, sepsis associated with abortion, pregnancy, childbirth, and postpartum, all these different types of things. So very important to get on top of those. And again, methicillin-resistant Staphylococcus aureus, or MRSA, as we commonly say, specific guidelines on that. And again, as mentioned, the codes are based on the organism responsible for the disease or the condition, right? And one of the items that's going to be on Canvas for this week is the Appendix I'm sorry, microorganisms. So this is something that you can look at, review, if you're a little bit unfamiliar with what some of these microorganisms are. So with the start of the chapter notes, we have diseases generally recognized as communicable and transmissible. You'll see some things in the code books to use additional code to identify resistance to antimicrobial drugs from the code category Z16. You still need to completely code the rest of it. And excludes one and excludes two. We just introduced you to these topics last week, but excludes one means that it's mutually exclusive. It can't be coded at the same time. Excludes two means you can only code these two conditions if it's documented. And that would be codes from Z22 code category. And again, the health record information needs to code the infectious disease. The coding is always based on the documentation. And these may present in some different ways. There may be a body site with an infection. There may be a specific organism responsible. Typically, significant infections are tested for. So that's how that comes out. You need to kind of understand the etiology of the disease and the severity of the disease, meaning, for the most part, acute and chronic. There's some combination codes and multiple codes, like conjunctivitis due to adenovirus B30.1. So if a combination code identifies both the condition, such as conjunctivitis, and the organism, the adenovirus, that's the code you use. You don't put a separate code for the adenovirus and the conjunctivitis. You just use the combination code. That's the correct way to do it. However, you do use multiple coding when you describe the etiology and the manifestation. In other words, when the infectious disease produces a manifestation within another body system, and the alphabetical index will identify when this is required. Sepsis, severe sepsis, and septic shock is caused by the body's immune response to an infection. The immune system releases all these chemicals, these cytokines and other things that fight the infection and trigger a widespread inflammation. And this release of these chemicals impairs the blood flow, which ultimately damages vital organs. Sepsis does not happen without a reason. In other words, typically there is some sort of an infection going on. Severe sepsis is an infection, but not only is it an infection within the blood, it's associated with acute organ dysfunction. So this is something that you'll see SIRS, SIR, systemic inflammatory response syndrome. So this is due to an infectious process with acute organ dysfunction, and one or more organs will fail. And septic shock is the next stage in this. It occurs in extreme cases when the patient develops very low blood pressure and heart failure. And then again, it's kind of a spiraling effect, causes circulatory failure, failure of the lungs, kidneys, liver, what have you. Severe sepsis requires at least two codes at minimum. You need to have a code first for the underlying infection. This would be something from A40 or A41 or codes from the OB chapter, meaning puerperal or post-procedural sepsis. The second code would be from the subcategory R65.2, severe sepsis. And then if septic shock is present, additional codes are required to identify the acute organ dysfunction, such as kidney failure or respiratory failure. You need to review the tabular carefully when you get to codes R65.20 and R65.21 because these codes are never used as a principal diagnosis. They cannot be first listed codes either, right? So there will be a reminder note in the tabular that will direct you to code the infection first that produces the severe sepsis. This is worth saying again. You can never have R65 or R21, R65.21 as a principal or first listed code. When severe sepsis is present on admission and meets the definition of a principal diagnosis, the underlying systemic infection is assigned as the principal diagnosis, followed by the appropriate code from subcategory R65.2. Present on admission, meaning it was here when the patient was admitted. When a patient's admitted to the hospital for treatment of sepsis and severe sepsis develops during the hospital stay, the systemic infection is coded first, and the appropriate code from the subcategory R65.2 is assigned as a secondary diagnosis with the present on admission indicator of no reported. If the patient's admitted to the hospital with an infection in particular body system, such as pneumonia, that advances to sepsis or severe sepsis, again, the code for the systemic infection is coded first, such as a code from A40 to A41, and such another code would be used for the localized infection, such as the pneumonia. And then, of course, the R65.2 code. If a patient's admitted to the hospital for treatment of pneumonia or another localized infection, the condition worsens to the point of having sepsis or severe sepsis. The localized infection is reported first. Additional codes are assigned for the sepsis or severe sepsis, and this would be such things as sepsis due to post-procedural infection or septic shock. And that's all I have for you. Come back for our next video lecture where we'll continue on with our discussion of coding infectious diseases, including HIV and AIDS. Bye now.